Hello. Welcome to all. I am Dr. P.B. Sarkar of Salt Lake Eye Foundation, consultant ophthalmologist. Today I am going to discuss an event which was done recently in Salt Lake Eye Foundation on a World Sight Day. On the 14th of October 2021, we observed World Sight Day in Salt Lake Eye Foundation. I thank Santen and Mr. Kaushik to be part of our program, and they helped us a lot to accumulate the data and to do the workshop in my clinic on that day. Today I am going to discuss about something or briefing something about the World Sight Day. What is World Sight Day? What is the necessity of World Sight Day? And what we did on that day? And how mostly we shall discuss about how to avoid the people to prevent their eye-related complications like blindness or pain in the eyes or something like that. So let us first discuss about something about eye. We shall carry out discussion both in Bengal and English in both languages, so that it can be more attractive or more understandable to all of us. So we have two eyes, and we know the eye is the most sensory organ of our body. Eye size of the eye is like spherical, small size. It is diameter is only 24 millimeter. And weight is 7 grams, and it is situated in two sockets of our face. So each eye is covered by 3 layers. First of all, I am going to discuss about the structure of the eye so that our later discussion will be easy to follow. So eye is covered by 3 layers. One is choroid, one is sclera, and one is retina. Choroid is the outermost layer. It is tough layer. It maintains the structure of the eye. It holds the eye in position, and it gives the shape of the eye like a sphere. Second layer is choroid. Choroid is the vascular layer that is full of blood vessels. This layer supplies nutrition to the eye, supplies nutrition to the other structures like lens, like cornea, like retina, etc. And the innermost layer is called the retina. Retina is the sensory part of the eye. It is full of nerve cells, rods and cones, and these nerve cells help us to generate vision. You see, eye is a two compartment. One is a bigger one on the big side, and then a smaller one. The bigger one is called is full with a jelly-like substance, which is called vitreous body. And before that, there is a small spherical lens which helps to transmit the light from the outside to the inside. And in front of that is the cornea. So eye can be compared with a camera. See, in this picture, the camera has a film, has a diaphragm, and an aperture, and a lens. Like that, our eye has a cornea, which is like the protective with the aperture, and there is a lens. There is a retina, like the film of the camera. So in this way, you can compare the eye with a camera. When light enters into the eye in this parallel rays, it passes through the cornea and focuses on the lens. Lens is a spherical material we already as we discussed. This lens converts light to the macula. The light from the outside of the world, outside the eye, enters the eye. By being converged by the lens, it focuses on the macula. Macula is the most sensitive part of the retina, where the nerve concentration is the most. mostly rod course is there. And this ray, when focuses on the macula, they generates a photoelectric sensation, an impulse. And this impulse, it is transmitted to the brain, going to our brain through an optic nerve, and then you can see. This is the structure and partial function of the eye. And the next question is comes, so what is vision? We always tell vision, our vision is good, our vision is bad. But what is vision? Say light enters, what I have told earlier, light enters the eye from the outside into the eye, and it focuses on the retina, and it generates the nerve impulse. This impulse transmits through the optic nerve going to the brain, and when it goes to the brain, then we can see. So eye is not, we do not see anything through the eye. We see something from our senses of our brain. So light going to the eye makes a photosensitive reaction, impulse generates, going to the brain, and then you can see. So then what is the function of the eye? If we do not see through the eye, then what is the function of the eye? Function is the eye is the communication between the external world with the inner world. It means it is a window of the eye, of the world. And eye helps us to communicate with others. We communicate with the world, we communicate with everything. And this vision, this eye, gives us the through the eye, through this vision, we enjoy our life. So our day-to-day activity, our life, everything depends on the vision, and which is responsible for the eye, and which generates impulse going to the brain and gives us the sensation of see or sensation of vision. Now let me tell something, inform you something about the World Sight Day. This year we observed our World Sight Day on 14th October 2021 in collaboration with the Centennial. What is World Sight Day? World Sight is a week. It is a week. We follow a week. That is an annual global event which draws attention on blindness and vision impairment. Because on this week, starting from the day on this week, we give our attention, we pay our attention to detect the blind people, detect the visually impaired person around us. And the objective is the awareness about the eye care, which I have told, detect blindness, and also treatment of that cause, so that our life, our vision becomes quality, our quality and vision becomes more better, and we enjoy our life more joyfully. Now the next question comes, what is the main cause of visual impairment? First of all is refractive errors. Next comes to cataract, glaucoma, macular degeneration, diabetes, eye disease, etc., which we shall discuss in my next slides. So let us see statistics. In the world, throughout the world, about 200 crores people are blind or suffering from eye disease. 200 crores out of 570 crores people, population of the world. About 100 crore people are suffering from the eye problem or impairment of eye vision, which can be treated easily. If we can diagnose this 100 crore people and detect the eye problem, that can be managed, that can be cured. And about 2.8 crores or about 2% of population of the 200 crores are blind due to so many causes. And India, 1.1 million, that means about 1 crore people of India are blind due to corneal disease. Mind if cornea is one of the main culprit of the blindness. like the diabetes retinopathy, like the glaucoma, like the AMD, age-related macular degeneration. Cornea is another culprit cause of this blindness. 1 lakh corneal transplantation is required in every year in our country, but we can manage only 25,000 per year. So demand of corneal transplantation is much more than the supply. Coming to the next slide, what are the common eye problems? The common eye problems are refractive error, dryness, digital eye strain, ocular allergy, eye infection, and eye inflammations. In this full group, the most important is refractive error. What is refractive error? Actually, when we born, we have most of the eye is emmetropic. That means they have no power. But sometimes the structure of the eye is so changed from birth or after some time, the light cannot focus on the retina correctly. That is called refractive error. And our goal is, our motto is to make the light to focus correctly on the macula. Let us see the first slide. See here, light is coming from the outer side, passing the cornea, touching the lens, and focusing on the macula. If light cannot focus on the macula, then we cannot see everything clearly. That is called refractive error. Refractive error has so many types. Mostly we can focus our attention in four points. One is myopia, one is hypermetropia, one is astigmatism, and one is presbyopia. We shall discuss these things after some time. Next common problem of eye disease is dryness. And due to this COVID period, most of our people are confined in the home, in the house, and doing a lot of digital works like mobile, laptop, or smartphone that causing dry eye. Dry eye is itself a disease. What is dry eye? In all of us, over the cornea, there is a natural fluid layer, fluid coating, which keeps the eye moist and helps us to see clearly. Sometimes what happens, this natural coating of the cornea, which is called the tear film, becomes dried up. When it dried up, cornea cannot get enough nutrition, cannot get enough lubrication, and the symptoms starts. Third is digital eye strain. Almost everyone nowadays know about the digital eye strain. Because of overuse of the laptop, overuse of the smartphone, overuse of the computer, and prolonged use of these things makes our eyes tired and dryness. That is called digital eye strain. Ocular allergy is another common problem nowadays that is reflected by itching, irritation of the eye, watering, and redness of the eye. This is maybe because of the systemic problem, or because of the environment, or because of the use of this digital articles. Eye infection is another problem. That is, we know about conjunctivitis, we know about pink eye. That is caused by so many types of virus, bacteria that cause infection in the eyes, and they gives us trouble in our day-to-day activity. Eye inflammation is more serious than the infection. Inflammation means the structure inside the eye becomes inflamed, more vasculature inside the eye increases, and eye becomes painful, becomes red, and the vision becomes blurred every day. Now let us see the types of eye refractive errors. Most common refractive error is the myopia. Myopia means the people who cannot see the distant objects but can see the near objects. In the children, they cannot. In the school-going children, they cannot follow the blackboard or whiteboard in the school. They cannot see it, the TV properly. They cannot see the presentation in the hall properly, but they can read books. This is called the myopia. Myopia, about 145 crores people throughout the world is myopic, and every day the number is going up because of the more use of the laptop, more use of the smartphone. The myopia is increasing day by day. In myopia, you see, when light enters into the eye, passing through the lens, they cannot focus over the cornea. So they cannot focus over the macula. That may be because of the size of the eyes more longer than the normal. I have already told the normal size of the eye is 24 millimeter axial length. But if the ray cannot reach the macula of the retina, the image becomes blurred, hazy. People cannot see the distance of this properly. And if you put a negative lens, minus power lens, which is called concave lens converges light. Yeah, a convex lens converges the ray, but a concave lens diverges the rays. So when we put a minus power lens in front of the eye, in a myopic eye, the rays now focus over the retina and you can see properly. This is called myopia. Hypermetropia is the reverse. In hypermetropia, people can see the long objects clearly, but cannot read a book. That is because of the length of the eye is smaller. It is smaller. If the eye is smaller, the rays focuses beyond the retina, not over the retina. And in that time, if you put a convex lens in front of the eye, the convex lens converges the rays going inside the eye, and they draw, and now the rays focus over the retina, and you can see properly. We know the term astigmatism. Astigmatism mixed type. This is not neither myopia nor hypermetropia. The rays going to the eye, it focuses haphazardly. Some rays focuses in front of the cornea, in front of the macula. Some rays focuses beyond the macula. Some rays focuses here and here. So that is always there becomes a hazy vision. In that case, we put a cylindrical lens over in front of the eye. So what is cylindrical lens? We know the convex lens is like a convex, is a spherical. We know the concave lens is spherical, but other side. But cylindrical lens, one side is normal, straight, but other side is spherical. So if you put a cylindrical lens over in front of the eye, the haphazard rays entering the eye becomes gradually focused over the macula, and you can see properly. This is called astigmatism. Many of us do not bother about the plus power of the lens, spectacles, minus power of the spectacles, but they bother about the cylindrical power of the spectacles. They think cylindrical power is something dangerous type of power, but not like that. Cylindrical is a type of power, but not dangerous. It is special type of power, special type of lens. And presbyopia. In presbyopia starts over the age of 40. You know, when we becomes our age touching the 40, we cannot see the printable letters of the book clearly. We have to keep the books away from the eyes. What is presbyopia? What is the difference between presbyopia and hypermetropia? Hypermetropia is the smaller size of the eye, but in presbyopia, eye is the normal size. But in that case, the lens of the eye cannot properly converge the rays over the macula. In that case, if you put a plus power lens in front of the eye in a spectacles, then you can see properly up to the age of 40. Please remind, in presbyopia, power gradually increases with age. Suppose at the age of 40, some people has a power of +1 in case of presbyopia. At the age of 45, that will be 1.5. At the age of 50, it will be 2. At the age of 55, it may be 2.5. And this change of power from the 1 to 2.5, 1 to 1.5 to 2.5 is normal. It is normal. If sometimes this increase of power is hampered, we may think there's some disease inside the eye. So this is the common refractive errors which I have discussed. This is a slide about the myopia or nearsightedness. The treatment is the wearing a spectacles with a minus power lens, wearing a contact lens, and surgical correction can be done by LASIK. Usually myopia is developmental and starts at age of onset from the child birth, but starts at the age of 4 or 5 and increases up to the age of 17, 18, up to the adolescence. And sometimes this increase is slow, sometimes this increase is rapid. So in case of myopia, every patient should check their eye at least once in a year. And in case of myopia, what is the symptoms, which I have already told? It is seeing distance objects clearly, and eye may be squinted, and there may be headache. This is about hypermetropia. Hypermetropia also corrected by the spectacles of plus power lens with a contact lens that can be managed. And there's some scope of LASIK in case of hypermetropia. In hypermetropia, we cannot see the patient cannot see the near objects properly. They cannot read the book properly. And for that, if they do not use the spectacles or if they do not correct the problem, the main issue, symptom is the headache, and the patient cannot read properly because of hypermetropia. Now let us discuss about the common eye problems in children. Up to the age of 4, every child should have a proper eye checkup by a competent ophthalmologist or optometrist. Because a child may born or develop some eye problem which should be corrected before the age of 8 to 12. We know from birth up to the age of 12, eye gradually becomes developed. Full vision develops at the age of 12. So if we cannot manage the eye problem in the early age, after the age of 12, that cannot be corrected throughout the life. So every parent must be careful about the child and have an eye checkup before the age of 4 years of age. What may be the common eye problems of a child? Refractive error, that may be plus power, minus power, centimeter power, etc. Lazy eye. Sometimes a child have a good vision in the right eye, but cannot see properly in the left eye, or vice versa. That means one eye is less powerful than the other eye. One eye is normal, other eye is not normal. This is called lazy eye. If you cannot manage the lazy eye in proper time, that it converts to amblyopia. Amblyopia means the power or the vision of the eye will not develop much in spite of good correction of by the spectacles. Strabismus or squint is another problem in the child. One eye, usually our both eyes is simultaneously. When you look to the right, it looks on the right side, left side. But in case of squint, one is normally straight, other is diverted. Both the eyes cannot focus at the same time. We know that we see a sub object like a pen. When we see a pen, we see by the both eyes, right eye and left eye. This is called binocular vision. When one eye is diverse, that time we see only on the one eye, and other is become diverse. Or we can focus on the left this eye and this eye diverse. So that is not a binocular vision. That is called a monocular vision. And the depth is child lost the depth of vision. Ptosis. Some patient develops with the ptosis. That means the one is smaller than the other eye. That can be corrected by surgery. And congenital watering. from the watering. Everybody means watering from the eye. Some in our face there's some gland called the tear glands is situated there at the upper corner of the eye, and from the tear gland always a fluid comes out from the gland and flashes over the cornea and going through the duct in our throat. There's a duct, a small narrow tube from the eye to the nose. You can see that one. If you draw the eyelid, you can see small hole in there. That is called a nasolacrimal ducts. Some child born with the narrowing of the ducts. When one duct is normal, other duct is narrow. In that case, water comes out from the eye constantly, and that should be correct. That should be managed early. Otherwise, this narrowness becomes hard and never it comes to the normal position. Congenital cataracts, we know the cataract develops at the age of older age, but some child born with the congenital cataract, developmental cataract, and that should be correct immediately after birth. Small child also born with the symptoms of glaucoma. That is very dangerous. It cannot manage properly. Eye becomes blind in course of time. And nystagmus. We have seen some people, some child, the eye is moving small, twitching very minutely. It's like some movement, small movement in the eyes. This is called nystagmus. Nystagmus is due to improper focusing of the light over the cornea, over the macula. So nystagmus is an eye disease, eye problem, and should be correct in proper time by a competent ophthalmologist. This is amblyopia. In amblyopia, eyes looks normal. There's nothing abnormal in the eyes, but one eye is lazy, other eye is good. This is very easy. This amblyopia is very easy to correct if the patients come to us very earliest. We give it. First of all, we do a refraction. We see if there is power or not. Sometimes what happens, one eye is high power, one eye has no power. So if we can give a proper spectacles at that age, the amblyopia goes, patient lazy eye becomes normal. But sometimes, even with the glass, even with the proper correction by spectacles, vision do not increase. That time, patching is necessary. Patching means covering of the one eye. Suppose this eye is lazy, this eye is less powerful, and in that case, if we cover the good eye and we focuses with the lazy eye, then gradually this eye gains some good vision. So, but this patching, one in the right, one this side, and other side, as advised by the doctor, with a good patching, a regular patching, not for one day, for day after day, for years after years, up to the age of 8, 9, patient gains a good vision. And if you do not detect the laziness in the early stage, and you do not give the proper treatment to the child, in future the eye remains less powerful and never gets good vision. So now screen. Screen is another problem. It is very obvious. Any parents can see a patient has a screen, and if they comes to us, if they comes to doctor, first of all we try to find out the cause of the screen. Then we give the power, prescription power of the spectacles, and we advise some exercise, regular exercise up to the age of 12, 13, like that. And sometimes, in case of screen, we need surgery. So before going to the next slide, I must tell something about the spectacles and the parents' behavior. We have seen in a chamber, whenever we have diagnosed the power of a small child, parents becomes annoyed. They tell us, doctor, can we manage the power without spectacles by some exercise or something like that? Please note If a child needs a spectacles, he must use it up to the age of 12 regularly. If not, the vision will not increase, it will not develop properly. So every parents must pay attention to a doctor's advice and advise the patient and encourage his child to wear the spectacles properly as advised by your doctor. Now let us come to the common problems of the adults. Till now we have discussed the common problems of the child. Now in the adults. Adults most common problem is the presbyopia. Next is cataract, glaucoma, age-related macular degeneration, and diabetic retinopathy. In this group, diabetic retinopathy, age-related macular degeneration, and glaucoma is the dangerous one, and if not properly treated, patient may become blind. But in case of presbyopia and cataract, we are hopeful. Presbyopia is not a disease. It is a condition of the age. I have told earlier, our eye has a property, lens and eye has a property which manages the light, quality of light, and focuses over the retina. When it becomes older, the lens of the eye becomes harder, and they cannot focus the ray over the retina. That is the condition is called presbyopia. In that case, what happens? In the childhood, in the younger age, you can read a book like that. You can read that. But when we becomes age of 40 or over, we have to move the book away from the eye, away from the eye, away from the eye, away from the eye. This is called long hand. Long hand is if I keep the eye away from the if I keep the book away from the eye, then we can read the books. But if I want to read the book from this side, this distance, we have to put a glass lens in our spectacles. That is called presbyopia, and the lens is called bifocal or progressive or like that. Next is cataract. Cataract is an age disease of the age. You know, our lens inside the eye is crystal clear, it is transparent. It is full of cells, transparent cells, colorless cells. But when you become older, the cells of the lens becomes gray, becomes degenerated, and as our hair becomes gray, these small fibers of the nerve fibers inside the lens becomes gray, and gradually eye becomes gray, and we cannot see the distance of this properly. Light from the outside of the eye cannot focus over there, cannot enter properly, can focus properly over the retina. That is called cataract. Cataract is cured by the surgery. There is no medicine for the cataract. Once cataract develops, we must go for a surgery. Third is glaucoma. Glaucoma, we tell them, is a silent killer of the vision. That is, glaucoma has no symptoms. Cataract has symptoms. If patients suffering from cataract, they cannot see the distance object. They come to us, doctor, I have a cataract. They see whether we have cataract or not. Presbyopia is very easy to diagnose. Patient can read the books from the near distance. But glaucoma has no symptoms. Glaucoma is a silent killer of the vision. What happens in glaucoma? In the first slide, in the structure of the eye, I have seen there is a compartment behind the lens is called vitreous body, and in front of the lens there is a small compartment which is full of aqueous humor. Aqueous humor is a fluid which generates from the eye and circulates inside the eye. It generates and comes out, generates and comes out. This circulation of the fluid inside the eye generates a pressure on the eye, and that keeps the eye in the structure. This pressure of the eye is called the intraocular pressure or eye pressure. The normal eye pressure is count in millimeter from 14 to 21 millimeter. Suppose this secretion or the production of the aqueous is more, or the elimination of the aqueous from the eye is less, then what happens? This fluid aqueous accumulates inside the eye, and they makes the eye, they develop the eye pressure more. In place of 17 or 18, they becomes 22, 23, 27, 26, 30, etc. This increased pressure inside the eye, it presses the retina, presses the optic nerve, and the cells of the optic nerve, the blood circulation of the optic nerve damages, and the vision is gradually decreased. And we doctors can diagnose the glaucoma with the help of a machine, which is called autorefractometer, or to measure the eye pressure by machine, appliance tonometer. And if the glaucoma is diagnosed, we prescribe medicine, and nowadays we have very good medicine in our hand, and the glaucoma is managed. Is known. Glaucoma is not a curable disease. It can be managed. It can be keeping in the normal position, and we can with the help of the medicine, with the help of the eye drops, we keep the good vision of the glaucoma patient. Now, age-related macular degeneration. What is that one? Earlier, people lifespan was not much, 60, max of 40, 50 to 60. Nowadays, with the help of good medicine, with the help of lifestyle, with the help of the other surgical or other medical facilities, the lifespan of the people has increased. Now, for 80 is the younger age. Some people are at the age of 80 is so young. So 80 is not age. So as the people lives more, the retinal nerves becomes damaged or degenerated more, and this is called the disease we call macular degeneration. Macula, where the macula, the most sensitive part of the retina, becomes degenerated. That means less functional. So when people becomes older, more and more older, they must consult doctor to find out whether they have any degenerative change inside the eye or not. And most common and most dangerous nowadays is diabetic retinopathy. You know, diabetes is a very common disease nowadays. Almost 1/3 of population of the world is suffering from some or more of diabetes. In case of diabetes, what happens? In case of diabetes, the blood circulation inside the retina hampers. You know, the retina is full of blood vessels. There's so many blood structures inside the eye, and this blood vessel has a coating over the arterial veins, small arterial veins. When in case of long-term diabetes, the coatings becomes weak, and the blood oxygen supply to the coatings becomes less. That causes the small hemorrhages inside retina, which is called diabetic retinopathy. Diabetic retinopathy, in the early stage, patient has no symptoms. When patient comes to us, we dilate the pupil, we put some eye drop, so that eye becomes dilated. We can see inside the eye with the machine, with the ophthalmoscope or something like that, and we can detect the small hemorrhage inside the eye. That is the diabetic retinopathy, and we should diagnose the retinopathy early. And if we can manage this retinopathy by proper control of the diabetes, proper control of the diet, and with good medicine, the vision of the patient remains normal throughout the life. So in case of diabetic patient, they must consult eye doctor regularly to find whether they have developed diabetic retinopathy or not. So in short, the common problems of adult is presbyopia, which is difficult of reading small letters in the book up to the age of 40, which can be managed by the spectacles. Cataract is the cloudiness of the lens, which can be managed by the phacosurgery or other cataract surgery. Glaucoma is the increase of blood eye pressure inside the eye, which should be diagnosed early, and the medicine, with the help of medicine, we can manage the glaucoma with the manage the glaucoma properly. And in case of macular degeneration, older people must consult doctor whether they have degenerated chance of inside the eye or not. And in case of diabetic retinopathy, at the same time, when you are controlling your diabetes inside diabetic blood sugar, I mean blood level, you must consult a doctor, eye doctor, to see whether you have developed retinopathy or not. So cataract is the I've already discussed this one, blurriness of vision, cloudiness. They cannot see or read books in dim light. Problems is the seeing at night, halos around the light, faded or color vision, etc. The cause is the obesity. The cause is the age, hypertension, high alcohol consumption, hormone replacement therapy, high exposure to the ultraviolet ray. Ultraviolet ray in the sunlight is one of the more common cause of the cataract. So nowadays we advise our patients to wear a ultraviolet protecting spectacles when they go outside. So cataract is very easy to manage. By surgery, you can, by LASIK surgery, you can, by phacosurgery, you can you can manage the cataract. Glaucoma is a disease of the retina or the high pressure inside the eye, and that can be diagnosed by the machines called autophotometer, Apple's chronometer, and so many medicines are available to control the glaucoma. In case of glaucoma, the main point of the glaucoma to remain controlled is the awareness. A patient suffering from the glaucoma, a patient, whenever he diagnosed glaucoma, they must consult the doctor at least twice in a week, twice in a year, 2 times in a year. And they should use the medicine properly as prescribed, as advised by the doctor throughout their life. Never discard the eye drops without advice of your doctor. How to put the glaucoma drops in there? This is called age-related macular retinopathy. In diabetic retinopathy, this is the healthy eye. This is the diabetic. This is the healthy eye on the left side. Right is the diabetic eye. You see there blood vessels, blood circulation, blood spots inside the eye. This is called diabetic retinopathy. Symptoms of diabetic retinopathy: spots or dark floating things in front of the vision. Somebody tells us they are seeing some black spots moving in front of the eye. That may be due to the bleeding inside the eye, which is due to the diabetes. Blurry vision, they cannot read the chart, or they cannot see the television properly. Fluctuating vision, that means sometimes they can see clearly, sometimes they cannot see clearly. That is the fluctuating vision. When the blood sugar inside the body is high, the vision becomes blurred. When the blood sugar is normal, vision may become normal. So this is another symptoms of diabetic retinopathy. Impaired color vision. In diabetic retinopathy, patient cannot diagnose the color properly. The red green color is not properly diagnosed. And dark or empty area of the vision. In the field of vision, there's a patch, they can see patches. Suppose you're seeing straight, there's a black patch inside in right side or left side. What is the risk factor? Is the poor control of the blood sugar is the main cause of diabetic retinopathy. Duration of the diabetes. If diabetes is more than 10 years, chance of retinopathy is higher. So, when some patient diabetes is more than 5 years, they must be careful about their retinopathy. High blood sugar and uncontrolled blood sugar and blood cholesterol. Also, smoking is another cause of the diabetic retinopathy. In case of diabetic retinopathy, please avoid smoking. avoid alcohol consumption also. Now, corneal ulcer is another cause of the blindness. Symptoms are corneal ulcer means some infection over the cornea. You see, there's a white spot in the left side of the cornea that is due to the infection in the of the eye by some bacteria or virus. Symptoms are redness of the eyes, irritation of the eye, discharge from the eye, painful eye, light sensitivity of the eye, patient cannot tolerate more light, lids become swollen, and the white spots on the cornea. These are the symptoms of the corneal ulcer. Cause is the infection from outside, that may be bacterial, that may be viral, that may be fungal, and that may be parasitic also. Treatment is the medical treatment and surgical treatment. But medical treatment depends upon the cause, use of antibiotic, etc. And sometimes it needs surgery to control the corneal ulcer. Now we shall discuss the most important factor in our last 2 years COVID-19 pandemic situation. That is the eye strain and eye problem. See, the lady is squinting their eyes because she is suffering a burning sensation or some pain inside the eye. Nowadays, because of the use of the smartphone, use of the e-books, use of the computers, use of laptops in the home, our screen time has increased a lot. And this increase in screen times causes the dryness of the eyes, irritation of the eye, watering from the eye, redness of the eye, itching of the eye, and tiredness of the eye. That means at the end of the day, if we cannot pay attention to our day-to-day activity, we become lethargic. What are the symptoms? Blurred vision, redness, irritation of the eye, intense headache, burning sensation, feeling discomfort, watering of the eye, and difficulty in focusing. Difficulty in focusing means suppose you have done something in your laptop or your smartphone, and whenever you see in the long side, you see everything hazy. That is called the difficulty in focusing. If after some time, after a few seconds or few minutes, it becomes normal. What is the percentage of increase of digital activity in this lockdown period, in this COVID-19 situation? 6% increase in the watching television, 57% increase in the watching news in the TV, 6 or 7% increase of the smartphone use. I think it's more than 6%. 3% video demand, 23% chatting, and 25% we spend our time in social media. How to prevent this eye strain? Keep your device at least 25 inches away from the eye. Lower the brightness of the device. Follow the 20-20-20 rule. That is, after work of 20 minutes, look at something 20 feet distance and blink 20 times. 20-20-20 rule. 20 minutes work, 20 feet distance, look at something and blink 20 times. It is very good guide, a good rule to keep your eye healthy and comfortable. Splash your eyes 3 to 4 times every day with slightly cold water. Use nighttime. Set your device nighttime mode. And turning off all overhead lights and blink mode. And one thing I must tell you, in our device, smartphone, laptop, and LED light, a Blu-ray comes out from these devices. This Blu-ray is good for our eye. This Blu-ray in adequate quantity makes our mood normal, makes us happy and joyful. But if this more light, this blue light comes more inside the eye. If the amount is more, then the retina becomes damaged. That causes the sleeping disturbance at night, and eye strain also another cause of this blue light. So we advise everyone to keep this machines like the smartphone or laptop at least 1 hour before your sleeping time. We have already told about lacking of the eye transplantation, which is due to the less availability of the cornea. So we appeal everybody to donate their cornea after death, so that from your two blind people can get good light and can enjoy their life. Thank you very much for being with us. I am Dr. P.V. Sarkar from Salt Lake Eye Foundation. I thank again Santen to give me the opportunity to discuss something about the eye awareness and to keep your eyes healthy. Take care, follow our advice, and remain healthy. Namaskar.
Rahul, you can stop the